Hello everybody, welcome back to the channel. My name is Ollie. I'm a junior doctor living and working in England, working in the NHS, and this quickfire news video, I said that there was a lot going on in the news at the moment. This is super relevant, super contemporary. This is about the rollback of compulsory vaccination for NHS staff. So just some background, it's estimated that there are around 80,000 unvaccinated NHS staff in England. Now the current rules, as they are set out by the government, state that NHS employees must be fully vaccinated against COVID-19, that is, having received 2 COVID-19 jabs by the 1st of April 2022. In order to meet the minimum time frame required between those 2 jabs, you would have to get your first jab by the 3rd of February 2022, so tomorrow in fact. These rules were passed in the Commons by 385 votes to 100 in December 2021, so that was the vote when it was decided that these vaccinations could become compulsory for NHS staff. Now on the 30th of January, it was reported that Sajid David, who is the current UK Secretary for Health, has announced a consultation on scrapping this requirement and that he no longer considers it proportionate for all NHS and social care staff to be fully vaccinated against COVID. This seems to be based on the findings that the Omicron variant of COVID-19 is being perceived as a milder infection, if you like, and the loss of these 80,000 staff could obviously significantly impact patient care and service provision. Interestingly, he's made no apology for introducing the requirement in the first instance, and he stands by the decision that was made at that time when it was put to the Commons. The rules as they are dictate that if you've not been fully vaccinated by the 1st of April, that you will not be allowed to work on the front line in the NHS and would either be redeployed or lose your job, with exemptions for those who could not have the vaccine for clinical reasons. Now there have been, obviously in the news, lots of very vocal health workers who've come out in opposition of the vaccine mandate, including perhaps most famously Dr. Steve James, who is an ITU consultant, I believe, at King's, who has done several public interviews now on the matter. It's clear that this doesn't reflect the view of the overwhelming majority of health professionals, but interestingly, as a very junior doctor, there have been some high-profile voices speaking up. People like Martin Marshall, who is the chairman of the Royal College of GPs, has said that he doesn't feel that a mandate is the right way forward on this issue either. So just a reminder that obviously in the news we are going to be relatively overexposed to a small number of people who hold this quite fringe position. Just for some further background information and context on vaccines, there are a range of existing vaccines that are compulsory for frontline healthcare workers in the NHS, including things like hepatitis B, varicella, which is the virus that causes chickenpox and shingles, and it is recommended, for example, that health workers receive their annual influenza vaccine, just to give some examples. There are more, but the point that I'm trying to make is that there are a series of vaccines that are already compulsory for frontline NHS workers, and you can't work in the NHS without them. An estimated 94.3% of NHS Trust employees have had their first dose of a COVID vaccine as we stand, and 91.5% have had their second dose and are fully vaccinated. When including those staff not in patient-facing roles, this might include secretarial, administration, IT, domestic services, etc., 1,395,268 people have had at least one jab, with 85,083 left unvaccinated. Since September 2021, there has been a net increase of 127,000 people working in the NHS who have received a vaccine, and 32,000 within social care. Proponents of a vaccine mandate, I think, say that healthcare workers have a responsibility to take steps that we can take to protect themselves and others from easily communicable diseases, and obviously a vaccine is a very simple and effective way to do so, just as we all did with the other compulsory vaccinations that are required for health workers. This is the view espoused by Dr. Nikki Kanani, who is the Medical Director of Primary Care for NHS England. If health staff refuse to get vaccinated, not just with COVID but with any communicable disease, this poses a risk to patients that they come into contact with who have no control over that, as well as the staff they work with. Critics of the mandates, however, say that pressuring people to get vaccinated impinges on their autonomy and is not the right thing to do, because it risks depleting an already overstretched workforce, which in turn, as I say, can lead to reducing the quality of patient care. in a given number of instances, although it's difficult to predict how widespread that would be given the number of staff that you're dealing with. So Sajid David will discuss the mandate with the UK Health Security Agency and the Chief Medical Officer. For England, this is currently Professor Sir Chris Whitty. But it seems quite clear that in any event, things are going to be rolled back. So now I just want to leave you all to think about this. We have a difficult situation where the majority of people in the NHS were vaccinated anyway. You then have a middle group who were initially perhaps reluctant to get the vaccine, but will have felt pressured by colleagues, by the political environment, and obviously by the government, who will have gotten vaccinated more recently at the threat of losing their jobs. Because obviously if you need a livelihood, as virtually all of us do, then you will probably have gotten vaccinated. But now we have this third group who will have become very firmly convinced that they were in the right by refusing to get vaccinated. And personally, I worry that they will take this as vindication that they were in the right by refusing to get vaccinated. And we need to be clear that that is not the position that the government is taking. What Sajid David has said and what this is all being based on is that the decision that was made at the time for a mandate was correct, based on the data we have. Based on the data that we now have, several months on, this response no longer feels proportionate, and therefore it might not be mandatory anymore. That is not the same thing as saying that you are correct to hold out. We need to be really clear that that is not the same thing as admitting any sort of liability or apology to the people that refuse to get vaccinated. That is not what has been said. So there we are, guys. Quick update on this story. Thank you very much for watching. Please be sure to hit that like button for me, leave a comment, subscribe, and I will see you in another video. Bye.